Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. My name is Muhammad Alsayid. I'm an assistant professor of medicine at University of Massachusetts, and I'm here with Dr. Kareem Sioufi, here to talk about his successful story to the residency of ophthalmology. I'm really honored to be with you, Dr. Kareem, and I would like to just give a brief introduction about what you have done in the medical field. So Dr. Kareem Sioufi, he started his medical school at University of Kalamoon at Dir Atiyeh in Syria in 2007. And then he transferred from the medical school in Syria in 2012, and he finished his medical school at the University of Medicine and Health Sciences in St. Kitts in 2015. After he graduated, he came here to the United States, and he started an ocular oncology research fellowship at Wells Eye Hospital in 2015, and he finished in 2017. After that, he started another fellowship in the Retina Research Fellowship at the same hospital in 2017, and he finished in 2018. The hospital is located in Philadelphia, Pennsylvania, and I'm really glad that we have him here today. We received great news a few days ago, I think almost 10 days ago, that he matched into ophthalmology residency, and he'll be starting in July. First of all, Dr. Kareem, thank you so much for coming here today and talking to us about your experience. Can you tell us
Pleasure to be here.
about? Thank you. Can you tell us more about the program that you matched at, please?
Of course, I just wanted to thank you first for organizing this and for all your efforts through the SAMS Education Committee and the Facebook Match Group. It's been tremendously helpful for everyone and all applicants that are applying this year. So thank you so much. Yeah, I'm very fortunate and lucky to match into my favorite specialty, into ophthalmology. I'll be starting in July. I have to do 1 year of prelim surgical internship, which I'll be fortunate to do at the same institution at the Medical University of South Carolina in Charleston. And then in 2019, I'll start my ophthalmology residency, which is going to be for 3 years.
That's great. I'm really glad that you're going to start there, and I'm sure it's going to be warm there when you
Oh yeah,
start. So,
escaping the blizzard of the Northeast.
oh, definitely, yeah. So it's going to be a little change, but hopefully for the best. So, how can you please tell us why did you choose to come here to the United States and finish your medical school at the University of Health Sciences?
Of course, as you alluded to, I started medical school in Syria, and I finished 5 out of 6 years. It's a 6-year program. With everything, with the unrest happening in Syria, I wasn't sure how things would unfold. So I decided that at that time, my best option would be to come to the US, gain some clinical exposure, and see how things play out. In summer of 2012, I saw how things escalated and found that my best option is to transfer to a Caribbean school, which allowed me to transfer in as a third-year medical student and graduate 2 years after. It offered me a great exposure to clinical experiences in different fields in medicine. I came to the US interested in neurology to begin with. And then I found myself in a neuro-ophthalmology clinic, and the rest was history. One day a resident took me aside and showed me how to use a lens to view pathology in a patient's eye, and I was just blown away to have the ability to just use lens and light to view pathology. In my mind, medicine used to be always as something you would think about. It's a mental process. It's not particularly visual. So that changed the game for me. And to be able to monitor how pathology responds to treatment, and to see how patients react with gratitude to what ophthalmologists do, just really pulled me into this field. So
That's
that
great.
was, yeah, that was what really pulled me into ophthalmology.
That's awesome. I think coming to the here to the United States, and of course it's a big step actually from Syria, and not many people are able to do that. And I've been in the Syrian American Medical Society Education Committee for more than 3-4 years, and I observed many people, they struggle to come here to the United States because of many issues. And I would like to ask you, like, did you have the chance to do any clinical rotations while you were at the medical school? Did you have a chance to go and do some rotations in the U.S., like any clinical observers or electives?
So in 2010, when I was in Syria, I came over to this for one summer in the States. I did the neurology observership in Florida. And until I transferred to a Caribbean school, I didn't do much of observerships or electives. But at the point when, as a Caribbean student, you have the opportunity basically to do all of your clinical rotations in the US. And that really offered me a great insight to what I would want to do, explore, everything that I might find interesting. So that was a fortunate thing to have. Not many, coming from Syria, you're not always, you don't have, depending on where you are geographically, you're not always offered that opportunity. And that's why I went with the Caribbean school, because it was really the best for my situation at the time.
I would like to ask you how did you choose that medical school in the Caribbean? Did you have the choice, or how did you find that medical school?
Yeah, so it's a little bit tricky navigating, because at the time I transferred in, I didn't know of anyone that had done that before, so I wasn't really aware of what it might entail. So if you look at a list of Caribbean schools, I'm not sure what the count is, but there are many that you can pick from. The biggest names are Ross University, St. George, that have been there in the Caribbean for over 20 years now, and are accredited in all states, in all 50 states. Other newer schools are not accredited in all states. So the question becomes, first, which school would accept transfer students? Second, what are their licensure like? Are they accredited in all 50 states, or are there restrictions? My school was a relatively a newer school, fourth class graduating from that school. So they don't have accreditation from all states, but I picked it because they had promising infrastructure, and they were working hard to get accredited, and I think they're slowly working on that still. So it really becomes a question of where you would want to do rotations, if they actually accept transfer students or not, and how limited are you by the licensure.
I see. So I think there's some difficulties in Facebook Live. They're having difficulty to hear you. I'm not sure why, even though I can hear you. Um, um, Maybe, do you want to try maybe using the computer speakers maybe instead of
Sure. Yeah, I'll try that.
yeah, maybe that will help a little bit. Um, I mean, I would recommend that you guys watch it on the GoToWebinar, because I can't guarantee the video and audio quality on Facebook Live. it's really hard. Um, but also at the same time, I would like to let you know that we are recording the interview, so it's going to be on YouTube. If you would like to, if you would like to listen on GoToWebinar, I would love to invite you there, and then you can listen and you can see the video. Um, so, talking about uh, coming here to the United States and doing some rotations here. Um, you mentioned actually this brief story when one of the residents he taught you how to use the lens and the light and to look in the eye. Was that the only factor that made you think about ophthalmology, or you thought about it, or what was there any other reasons?
Yeah. Well, there are multiple reasons why I choose that field. First, like I mentioned, the visual aspect of understanding disease and treating pathology. Second and foremost, seeing how what ophthalmologists can do to help patients and improve the quality of life for patients. I think there are 14 million people that are suffering from blindness on this planet, and they're unable to perform tasks of daily living. 85% of those causes are reversible, and as an ophthalmologist, you get to help those individuals who are usually dependent on someone else. So you have two people taken out of society and affected by blindness, and you get to restore vision sometimes. And when you look at the miracle of cataract surgery, which can be done in 10 minutes, and you restore someone's vision and help them become an independent individual and big contributors in the society. So that's the most rewarding patient-doctor relationship that I've witnessed in many fields of medicine, and I don't think anything else tops it. And the third reason that really drew me into ophthalmology is how dynamic this field is. There's always something new, whether it's treatment modality, a new medication, which we just heard about, the new Leber's neuropathy medication that was just approved by the FDA, new surgical techniques, new lasers and cameras to diagnose and study the eye, and what comes to almost tissue histopathology resolution. So all of that, the dynamic of how much development and research is going on in the field really drew me into it.
That's great. I think that's a very good actually motivation point. It's amazing when you restore someone's sight and you bring them you bring their vision back. Actually, it's amazing because you actually restore their life. They can see their loved ones. They can communicate with people better, and especially for
Exactly.
old people because they lived all their life and they are able to see. And then when they develop a major problem like cataract or other diseases, then they would like to restore their lives, and that's actually amazing. And
Exactly.
I hope in the future you'll be one of those doctors that will continue to do more research and find new ways actually to help people and restore their vision.
Yeah, I'll be very fortunate if I'm counted as one of those that would be able to contribute back to society and the field that I've learned so much from so far.
Great. I would like to ask you what are the key factors and the main factors that helped you to get into ophthalmology residency?
I think the key factors that really helped, being an international medical graduate, well, let me start from the top. Ophthalmology itself is a very competitive field, and not just for IMGs, International Medical Graduates. It's just a competitive specialty, even for US graduates and US seniors. A limited number of people go into residency, about 475 across all programs. 475 starting 2019, so they increased number of spots this year. So if you look at that over time, that means it's a smaller community, it's a smaller society of ophthalmologists. And word of mouth, or, you know, letters of recommendation go a long way. So I think for me, coming in as an international, first off, you need to find mentors that will be willing to support you, encourage you along the way, and get you plugged in the community to help you navigate the waters as well. You know, you can only go so far by putting so much effort, but you might be doing it the wrong way. You might be not doing it the smartest. You might not be taking the smartest path of getting to your end goal. So you always need mentors to kind of guide you and you know, help put a good word in for you, that you're a reliable person, you're an honest person, and that you're someone who they want to see in the community of ophthalmology. So that was one key factor. Another key was to be able to perform research. A measurable metric to how productive you are in the field, or how driven you are, and how much you want to contribute is publication. So that's a key. It always helps, you know, when people have publications on their resume. That goes a long way. And so, and most importantly, and I can't stress this enough, support from family and friends. It's a tough challenge taking on something as competitive as it is, because over the years, Muhammad, I can't tell you how many people said, you know, you're kind of crazy. Why are you doing this? You'll never get it. Like it's too competitive. And I had average scores. I didn't have any stellar scores. So when, you know, first off question, what do you want to do ophthalmology? What were your scores? Average scores. And they just like blew me off. Like, what are you doing? So you need to have support. You need to have, you know, family, friends that, you know, really encourage you along the way, because it can feel isolated when no one else is really doing, you know, no one has really blazed the trail for you. So mentors, support from family and friends, and mentors in the field, and research and publications really were the key factors, I think.
I think that's a great summary, actually, what you are telling us. I would like to tap into publications, because I think finding a mentor, especially in research, is very important. But also having family support and friend support also is important. However, I think if we focus on publications and finding a good research spot, I think that will also help a lot into the process. During your search for any kind of research opportunities, do you have like a list, or can you name a few places that you are looking into? So maybe other people in the future, if they wanna look into these places, of course, including your hospital, Wells Eye Hospital.
Of course. I'll share a link with you, and I'll circulate it around the web. Utah University compiled a list of what is called a pre-residency fellowship, or pre-residency research fellowship. There's a different number of institutions that have that such position, designated spots. The key is, I think, in doing research, and I'll go into detail which places are good spots to seek. But I think the key in doing research is you can be doing research in basic lab, which is great, scientifically great, but you want to be doing something that will, cause traction and draw attention. You want to be doing something new, cutting edge. So I think in terms of ophthalmology, your quickest turnaround and attention grabber would be imaging, ocular imaging in ophthalmology. And a lot of places are opening what is called now OCT fellowship, which is optical coherence tomography fellowship, which is a purely imaging based fellowship. Tufts University is a medical center is doing that. Casey Eye Institute out in Oregon, in Portland, Oregon, is doing that. And most of the retina related research fellowships would entail a lot of imaging too. Wills Eye is a big place for research, clinical research, which is really what you want in ophthalmology. And that's how you get to meet, the people and the community, is by doing the research, submitting your work to conferences and going there, presenting your work and connecting with people, discussing ideas, and collaborating when you go to conferences, and sharing ideas and projects to collaborate on from other institutions. So Wills Eye is a big place. Tufts has a good research fellowship. Ocular pathology is another route that many people consider doing, which I think you will learn a lot from doing ocular pathology, but it might not be as fruitful as doing imaging research. So there are a lot of options, and I'll make sure to send you a list or share this on Facebook.
Yeah, that would be great. So we can put it actually on the Facebook page, and then we can share it with everyone who's interested in doing this. One of the common questions that they usually ask you, and I'm sure they ask you that before, is doing internal medicine residency, like finishing a categorical or prelim internal medicine residency or surgery residency, will be helpful, or would it increase the chances to get into ophthalmology residency?
Yeah, that's a question I personally struggled with, whether if I should do start a residency in medicine or surgery and maybe halfway transfer, or complete it and then transfer. If you complete a residency, there's an issue with funding from the government to the program. You only allowed a certain number of years of residency to be funded by the government. So if you've done one residency and followed by another residency, depending on the number of years, that might be problematic. Second is, you really don't want to have something else besides ophthalmology. Your resume should be all ophthalmology, ophthalmology, ophthalmology. Your personal statement as such. You don't want to be portrayed someone who was jumping ship. You want to be someone who's seen as dedicated, someone who's persevered to pursue that goal in mind, and just set on ophthalmology. They want to see that passion in applicants, as I'm sure, and that also applies to many other specialties. But I think having a different residency on your resume might be more negative than a positive thing.
I see. So do you think for someone, let's say, who finished ophthalmology for residency outside the United States and would like to come to the United States, so from what I hear from you, I think the advice will be go to a big university that's doing ophthalmology research, do maybe 2 or 3 years of research, and improve your resume with good scores and good network, and then apply to ophthalmology. And there will be a good chance, because if someone has already an experience with ophthalmology, then maybe that will be, of course, that will be an advantage. Is that right?
Yeah. So, it's always seen as a great experience, but they will always look at it as you're not trained here, so we don't really know how you were trained. But I had a friend who was applying this year, who he's from Iran, and he was an ophthalmologist there, and he got accepted this year. Uh, he did 2 or 3 years of research, and eventually he made it in. So, it definitely helps, and it's seen as a positive thing. You're a surgeon, you've done surgeries before, you know what we're talking about. But it's not something that would be required. A lot of people, come in not having done residency in ophthalmology, and still be able to match.
Great. I think that I'm really glad that you opened the door into ophthalmology now this year. I'm aware that in the last 5, 6 years, people they started to get into rare residencies and like orthopedic surgery, radiology, anesthesia, and anesthesiologists. So they started to go into these residencies, especially from Syria. And I'm really glad that I see Syrian doctors every day open the door for their junior students and other doctors from Syria to pursue this kind of residencies. I'm really happy that I have you today here in this session. Do you have anything in mind or any points that you would like to add? And then after that, we will take questions. If you have
Yeah.
any questions, I would like you to write your questions on GoToWebinar or the Facebook page, and we'll try to answer them if we didn't answer them already. Yeah. So, do you have any other comments or points that you would like to talk about?
Yeah, I agree with what you just said. It's not often that we hear of, international graduates from Syria or other countries that are, motive or have the courage to pursue it, because, again, I can't tell you how, much of pushback you will meet once you take on a challenge like this, which is, again, brings me back to the support of family and mentors. But at the same time, you have to be positive. You have, if you feel like this is what you have to do, if this is your calling, this is what you want to do for the rest of your life, and that's what you will enjoy doing, then it's something that you're more likely to be great at and good at, and be able to serve the community with excellence, because you're actually passionate and motivated to do that specialty. So I would say commit to your passion and stick to it. Approach the path of achieving your goal with organized and focused efforts. And no matter how dreary or hopeless things may seem, stay positive and optimistic that all your hard work and efforts will eventually pay off.
That's great. I love these points, and I think we actually I actually personally agree with you that the key factors of having family support, mentors, and research are the main factors. And at the same time, I would like to emphasize on the family and the friend support because. Yes, maybe medically and knowledge-wise, we're doing great. However, on the psychological part, I think it gives you a great push in forward to help you keep you motivated and keep you fresh every time you're feeling tired. You have someone that will keep reminding you about your goal and keeps you motivated. And I think that's why it's very important to have the support, to have a mentor that will keep you on track in each step that you take into this road.
Absolutely.
I'm really happy to have you, and I would love to have you um, for more. Actually, let me take some questions here. We
Of
got the
course.
first question. It says, "How do you find mentors in this specialty?"
Yeah. You can approach it systematically in a way that you look in each subspecialty that you're interested in, or any subspecialty in that field, and look, search for the the leaders of the field. Look at PubMed, see who has contributed a lot to the field. Someone who lectures, if you are interested in ophthalmology, look at the schedule for American Academy of Ophthalmology. See who are the big hitters there, people that are active, in academia and in policy making in that field, and that's how you would find mentors. And basically people who really contribute to the field. So by either looking for their research metric indexes on PubMed, and and conferences.
Great. Another question, it asks, what's the accepted USMLE score that may allow me to think of ophthalmology residency?
So that's so I was looking at, I think the stats for the match this year of January 2018 just came out in the past few days. I was looking at it today. The average matched applicant had a step 1 score of 245. The average unmatched applicant had a step 1 score of 228. I would say those are the stats, but at the same time, their rules have exceptions, and even if you're below that threshold of unmatched, it's still an average. It's a mean. So there are outliers there. So don't be discouraged by those numbers. I think if you're 220 and above, you're fine for your step 1. They don't really list a step 2 cutoff. Or there's no cutoff, but a lot of programs, as you know, even for other specialties, filter out applicants based on step 1 or step 2. But in terms of stats and numbers, the average for the match is 245.
Nice. Another question, it says, I did a 2-month elective course in UIC ophthalmology clinics. Do you think that will help me in the future?
Potentially, depends on the quality of the experience there. If you build relationships there, maybe worked on a research project, got to meet the people, or if you wanted to come back again and stay with them long term, because I know UIC are very active in the world of ophthalmology research, and they might be welcoming, and it's a connection. I would definitely take advantage if you have a connection in there. But don't limit yourself to one place. If that place doesn't pan out, there are many other places. I remember sitting, across, on my desk. I think I emailed more than 50, 60 programs, trying to find research opportunities. And then, I ended up landing in Wilseye. So don't be discouraged. You're gonna hear a lot of rejections and no's. Just stay persistent and persevere on your goal.
Nice. Another question, it says, is it the first time that you apply to the match? And if you are doing research for a few years, when do you feel or when do you think that this is going to be the right time to apply for residency?
Yeah. That's tricky. Yeah, this is the first time I match. I apply and match. It's one cycle, my first cycle. But the question for when do you think you might be ready? I started off my fellowship thinking, well, I'll do 1 year and then go into the match. Research was, coming into a research role, I realized that's not how it works. You need to give it time to be productive. At the same time, you really want to put your foot in there. You want to meet the people. You want to be, you know, known in a way that you're someone who is on the rise, someone who is interested in the field and is showing up to conferences, showing up multiple conferences and meetings, even smaller meetings. You just want to be in every opportunity. You show up to every opportunity that might open a door for you. I can't say when someone can be ready, but you know, I think a senior U.S. student applying for ophthalmology, on average, from the people I met on the interview trail, they had anywhere between 2 to 4, maybe 5 publications, some of them up to 10 publications. So that gives you, you know, what the average applicants coming from U.S. schools are doing. So you want to kind of rise above that. You want to go the you know, put more effort into it. And again, that emphasizes the importance of having a mentor. You sit down with your mentor, you know, lay out all your credentials and discuss it with them. You know, for me, I first year around, I spoke with my mentor, and she suggested that maybe it'd be better for me to wait another year, and that's what I did. So having mentors is absolutely important in making big decisions like this. Am I ready to go into the match this year or not? Because, you know, and I don't want to discourage those that applied and are reapplying next cycle, but it's something that will stay on your record, that you applied the first time and maybe you were not ready, or for some reason, you know, it wasn't that year that you were lucky enough to make it in, or some misfortune happened. But you really want to try and build all the steam and go in, and not have multiple attempts.
Great advice. One more question. It says, is it true that some ophthalmology programs require a special eye test to enroll in their program, and should the applicant, before pursuing such a tough path, to do that test?
Yeah, it's funny. I think as a requirement, 2 programs ask that you fill out a form of visual acuity and a stereoscopic test to make sure that you have a depth of field, you know, a depth for your vision when you're operating in someone's eye. A few other places will do the actual test on the day of the interview, which is a little bit strange, but I think majority of programs, I interviewed at 9 programs, none of them had that test or asked about it, and some of them are, you know, good programs. So I wouldn't be discouraged or, you know, too concerned about that eye test.
Okay. Well, if they do that test, maybe I'll fail. So it's impossible for me to be an ophthalmologist. So it says, another question, and I think we're going to conclude with that one. Is it possible to secure a research opportunity in ophthalmology while outside the United States?
It is possible. It might be not as easy as being in the US, because some people, you know, some institutions don't really want to bother with potential visa problems. So, you know, I'm saying that it's you know, it's doable, but it might not be as feasible as being in the US.
Nice. I think I'm going to conclude now with that question. I would like to thank you again, and congratulate you on this match. I'm really happy to have you here today, and it was a fantastic and wonderful session with you, Dr.
Oh,
Kareem
it's a pleasure
Sioufi.
to be here, and you know, I'm really glad to be able to share my story and hopefully inspire and encourage, you know, give some hope that it's not impossible. It's definitely doable. If I can do it, anyone else can do it. It just needs time and effort and work. So thank you for organizing this.
Thank you so much for sharing your story and the experience. And we would love to have you in the future for more interviews. And inshallah, we wish you all the best. And thank you again. And I would like to remind everyone that this will be posted on YouTube on the SAMS Education Committee YouTube channel. And also, we will share with you the list that Dr. Kareem Sioufi will provide us. Thank you very much. Thank you, everyone, and have a good night.
Absolutely. Thank you. Have a good night.